This program is brought to you in association with First National Bank of Botswana.
FNB, how can we help you?
Good evening and a very warm welcome to First Issues. I'm Manase. Thank you so much for joining us on the program. Life can be overwhelming, especially when you have to throw in the demands of work. Assignments, weekly reports, endless meetings, and getting slack for not meeting targets. Having to juggle all of that with the demands of everyday life can have a mental toll on even the best of us, which can lead to a lot of health problems, including a lapse in our mental health. Mental health problems have become all too common with the burdens of an ever-changing world. This proving to be an escalating problem for employers all over the world. It is reported that 1 in every 5 people suffer from a mental health condition, with depression being the most prevalent with 300 million cases globally, according to the Pan-African Health Office. Due to this, the annual global cost relating to mental health problems is estimated at $2.5 trillion and is expected to rise to a whopping $6 trillion by the year 2030. Needless to say, depression at the workplace is said to be the leading cause in a rise in lost productivity, leave days, and premature retirement. Tonight on First Issues, we will be talking about mental health at the workplace with 3 guests: mental health advocate Charity Kennedy, who survived major depression, therapist Keletso Motsage, and human resources practitioner Opedi Manase. Our first guest, Charity Kennedy, shares how her depression made it very difficult for her to work a 9-to-5 job, as it was virtually impossible for her to be the slightest bit productive.
In 2010, I was diagnosed with major depression, which affected how I relate with other people, which affected my ability to complete small tasks, and also affected my emotions, like I was teary and I couldn't stand being in crowds or having people that I don't know around me, and affected my self-esteem. So it really affected my work relationship, like be it at home, in the workplace. I couldn't really stand certain things because of that diagnosis.
Charity says her own experience with depression helped her set up an organization called Botswana Network for Mental Health. Through this organization, they realized a lot of gaps in how mental health was addressed at workplaces and indeed in Botswana.
The gaps are really serious in terms of policy level, but let me start with what we have been doing as Botswana Network for Mental Health in the past years. We have a program called Workplace Mental Health. It is a program which we are used to empower organizations on issues of mental health in the workplace. How do you early detect issues of mental health in the workplace? How does issues of mental health affect productivity in the workplace? And also maybe empowering the staff with the coping skills and extending to giving them therapy as well. And we have held 2 mental health and productivity summits, where we were in partnership with organizations like Botswana National Productivity Center, trying to integrate mental health into the workplace policies. Because right now at a policy level or at a legislative level, we have what we call the Mental Health Disorder Act 1971. So when you take that act, there is nothing to the extent or to the effect of talking about workplace. Rather, we talk about maybe workplace at a policy level. So it gives organization a platform not to feel binded to develop workplace mental health policies, because there is nothing at a legislative level that is speaking to that effect. So it is a gap that we're having. But since COVID-19 outbreak, we've seen government trying to be a bit proactive in terms of setting aside psychosocial response team that was addressing the burnout on the frontliners. But we should understand that it is not only the frontliners who can have burnout, even other areas where we have staff, they can have burnout. We need to try and upscale the workplace mental health at a policy and legislative level so that organizations may have something to draw from and develop their own policies.
Mental health problems have a direct impact on workplaces through increases in absenteeism, presenteeism, where a person is physically present but not productive, disability claims, injuries or illnesses, complaints by other employees or clients, and/or legal implications. While these are the realities of this condition, what are organizations doing to accommodate people with mental health problems? But most importantly, how are they advocating for a work environment that is mental health friendly to prevent mental health issues? Also, just how important is it for employers to recognize the need to create work environments that support positive mental health? Joining us for this talk is therapist Keletso Motsage and human resources practitioner Opedi Manase.
I think it's important to note how much is lost on a yearly or quarterly basis based on mental health issues not being addressed in the workplace. The World Health Organization has reported that over $1 trillion is lost every year due to anxiety and depression being undiagnosed. There's an issue of presenteeism where people attend work, they're physically there, but they're emotionally, mentally unengaged. They're not able to perform their duties due to the mental health issues that they are struggling with. So it's important that workplaces create an environment that nurtures openness and realness and honesty, so that when people have mental health issues, they know where to go, they know what to do. Because you'll find that, for example, if someone has a flu, they are comfortable to go and say, okay, I'm not feeling well, I need to go see the doctor. But if someone needs to go see a therapist or a psychologist or a psychiatrist, they feel uncomfortable because the environment does not allow them to feel free enough to speak about what they're going through, to be open about the symptoms that they're experiencing. So it's about nurturing a culture of openness where we talk about mental health issues, where we normalize it within different cultures and environments within the workplace.
Opedi, as an HR practitioner, how has the advocacy for workplaces that support positive mental health been met?
What I can say is that mental health has always been an issue that nobody wants to discuss, even in the workplaces. Whenever somebody wants to raise an issue, for instance, if HR wants to bring somebody to come and talk to the staff members about mental health, we do not get the support that we need because people believe mental health is not an illness. But if we try and have it in the office, if we try and accommodate it in the office, then it presents all sorts of malice, and it has been a very uphill task for us as HR professionals and as organizations to actually accept mental health into the organization, actually embrace the mental health activism in the organization.
When running a business means
Where did I put that receipt?
we can help you with instant accounting, free software that does your bookkeeping for you. When running a business means
Wait, what do you mean the container hasn't arrived?
we help protect your business from risk with Motsage Insurance. And when it means
How do we pay our staff that don't have bank accounts?
we help you make multiple payments directly to people's phones with e-wallet bulk send. At FNB, we're constantly innovating to help business owners at every stage of their journey.
Welcome back to First Issues, where our conversation on mental health at the workplace continues with therapist Keletso Motsage, adding on to what her colleague Opedi Manase said about how advocacy for positive mental health at the workplace has been met.
In addition to what my colleague has just said, I think it's important to note that due to discrimination and stigma, that's why there have been certain issues, and that's why it's been an uphill battle for them. But I'd like to commend the companies and HR practitioners that are actually, really focusing on the importance of mental health. because mental health and physical health are just as important, if not more, because if you are not mentally sound, you can't take care of your physical health as you would if things were going well. So I think it's important to focus on, really getting rid of stigma and discrimination by educating people. The more knowledge we have, the more equipped we are to deal with things. And like I like to say that people respond out of fear when they don't understand something. But let there be knowledge within the workplaces to create that platform so that it's easier for people to discuss it, so that it can be addressed in a more open and honest way.
Keletso, I don't know if that answers my next question, because I want us to talk about just exactly how employers can improve their conditions of service so that they can be supportive of people with mental health problems and to prevent those who do not have them from actually developing them.
Okay, I think with that it's important for there to be proper screening at the beginning. When people come in, when they're inducted, for there to be openness. For example, if I come in with a mental health issue, it needs to be accepted and acknowledged by the people who are hiring me, so that I'm free to say, okay, I need to go for a checkup or I need to go get more medication, so that there's that knowledge and it's accepted from the get-go. And for there to be mental health campaigns, for example, companies taking on the responsibility to maybe have a mental health week every week, right? And for there to be information like posters with information, for example, if you want counseling, go here. If you want psychiatric care, go here. Basically, making sure that there's a flow of information within the companies, and then also having discussions as a group, because it's one thing having emails floating around with mental health information or having the information being displayed, but let there be conversations to ensure that people are engaging with that information and are internalizing it.
There has to be a policy that actually sets out the standard for how things should be done. If you look at organizations now, they have a comprehensive wellness policy that does not even cover mental health. It's just the policy of saying you should be doing this, you should be doing that. But what about the mental health part of it? You see, and even if you have a mental health part of the policy, it's just a generic policy that is not catered to the organization. We need to look at the organization, the stresses that the organization gives to the employees, and how then can we then help keep the mental health of the employees in check. Starting from the orientation level. If you are having a very stressful job, then it should be mandatory that you get counseling every quarter or every month end or every day. You need to actually make sure that employees are taken care of from the mental health upwards. As we have those wellness days, wellness talks, wellness days, we need to have mental health days, mental health talks, because if we have such, we create an environment where actually employees are free to talk about mental health. Employees are free to report incidents. Employees are open to go to HR, to go to their senior managers, and they talk about mental health. They talk about what they are facing, knowing that there won't be any discrimination and that they are going to get help.
Much as I appreciate the very instances that you've been giving with your colleague here, what clear examples that signal a change in this space, or that can make a change?
From us as the HR Society, at the beginning of the year when the COVID-19 started hitting, we actually had a webinar where we were just trying to educate and upskill the HR professionals in Botswana about mental health in the workplace, what they should know and what they should be doing. And we have actually shared contacts with them, and we keep them in check to find out how far they are with implementing some of the recommendations that the Botswana Network for Mental Health had already done at the webinar. We are developing the national HR standards, because we do not have any policy whatsoever in Botswana that has to do with mental health. But because we want mental health to be included, we are developing national HR standards that will look at policy level in the organization, because the Act does not speak much about mental health or anything, the Employment Act. So what we want is HR audit unit that will go into organizations and look at their policies, not only mental health policies, but all the policies that will actually ensure that employees are taken care of. And that audit will then be the one that has to share with the organization, so that the organization can simply say, we are mental health compliant because of 1, 2, 3, 4, 5 principles, looking at the standards that have been developed and that have been published and that we expect all HR professionals to follow, so as to have the mental health in the workplace.
In addition, it's very commendable what HR practitioners, what my colleague here has started, because it's important that there be proper policies in place in order for people to know what to do and what the standards are. You know, incorporating mental health days, activities, maybe having a department or someone who is in charge of it, basically assisting the HR department to ensure that all the mental health standards are met. You know, maybe having a wellness officer who's specifically in charge of mental health standards and ensuring that those things are done, all the things that we have been discussing, just to help the HR to support them in that mission, so that it's a team effort, so that it has more staying power.
We should not only have that person as a wellness person. That person has to be stringently trained on mental health. We do not want to put people that are just for ticking boxes. We want this to work, because we believe that mental health is actually a curable disease. Now, if we have wellness people who are trained, if HR people are trained, if supervisors, if the employees are trained on mental health, this becomes an easy task for the organizations to actually care of the mental health of their employees.